Hey, um, pregnancy update. I didn't expect to have an update so soon, but here I am back at you, bringing you an update. Um, where do I start? Last night at about 9, 10 o'clock, shortly after dinner, I was sitting there and just started getting really bad pain down in my left lower abdomen. I've been having pain all along. It's not been so bad. I've been told that it's growing pain. But this pain was only on one side, and it was really, really, really bad. So I tried to do everything that I could, move around, lay down, get up, walk around, try to do everything I could to get rid of the pain, but it just wouldn't go away. Um, so if you know me, you know how much I hate the hospitals. But the pain was that bad, so we went ahead to the emergency room because I didn't know what it was. Um, I know down in that area it could only be one of two things. One being a cyst, two being an ectopic pregnancy. In IVF, they put them in uterus, but there's no guarantee that they're not going to float on down to the fallopian tube, and I can still end up with an ectopic pregnancy, and so that's what worried me. So the pain was great enough to make me go to the hospital. We left here at 1 o'clock in the morning to go to the hospital. So we get to the hospital. No bleeding or anything like that. It was just a severe pain. We get to the hospital. They start asking me the questions. Look, I got my little band. And so they start doing an exam, and then I still got my little thing on too from the blood draw and everything like that. Anyways, they start asking me questions and start with the exam. And he started doing the palpation exam where he goes and touches everything to find out where it hurts. And he gets to the lower left side, and I almost jump off the table. I was in so much pain. So immediately he left the room, and he's like, I need an IV, I need some pain medicine, and I need some blood drawn right now. Because if you don't know, ectopic pregnancy is a serious medical condition. You can actually die if your tube explodes, if you will. So they get in and they do all that stuff, and they get the IV and everything started. Give me some morphine. Morphine is safe during pregnancy because, believe me, I asked. And they come back and do a ultrasound. So they get in there, and it was so funny. The doctor and the nurse just kind of like stopped and looked at each other, and they were like, there's twins. Are you pregnant with two? And I was like, yeah. They put two in, and they were like, oh my gosh, thank God. There were two in my uterus, and both of them have a heartbeat. Both of them have the little flicker that you can see as their heart beating. And they were like, oh my gosh, I wasn't sure if it was two or what was going on. So that moment, all the pain, I guess, just pretty much disappeared, and I became elated. So they confirmed last night that both of our babies are in the uterus as they should be, growing properly. Both of them have a heartbeat. They gave us the sizes up close of them. One of them is 5 weeks, 2 days, and one of them is 5 weeks, 5 days. The pain came from a cyst. I had no idea that I could still have cysts during pregnancy. Well, come to find out, I can still have cysts all the way up to my second trimester. And these cysts that I had were consistent with IVF. There were several cysts on each ovary, and what happened was on the left ovary there were several cysts, and they were filled with fluid still, and some of them popped, and the fluid was floating free in my abdomen, which causes severe irritation. I didn't know that. They wouldn't give us a picture, you know, the little ultrasound pictures of the babies. So when they left the room, I had hubby take some pictures of the babies. This one is the best side of the two little babies. Let's see, I got another good one in here. Here's a good one. The two little, again, the left side is the good side. Or my left, your left is a good side. So, as I told you guys, we are pregnant with twins. They are both implanted in the correct place, growing wonderfully, heart beating just exactly on schedule. I am so happy. The pain this morning, the morphine that they gave me, knocked it out. I can tolerate pain very, very well. So this morning I'm still a little bit sore, but they said it's expected because I had so many cysts still on my ovary. But they said it is completely normal after IVF to see something like that. I just need to be followed. And so they told me to call my regular doctor on Monday, because they want to make sure that they're keeping an eye on that cyst on my left side. So I'll be calling them on Monday, and I'm sure they're going to want me to come in, and I'm sure they're going to want to do another ultrasound. Hopefully they'll give me the paper picture so I can actually have a paper picture of the boys. But I got it on film anyway, so I am extremely happy. So that's my update. And after Monday, after I talk to my doctor, if anything different changes, I will let you know. Remember, guys, thoughts become things, and I'm 100% proof of that. I think positively. I told my husband several times last night, honey, it's a cyst. I know it's a cyst. First of all, because I have a lot of cysts, and I know what they feel like. And but because we didn't know, and I'm pregnant, we know I'm pregnant, but we didn't know what the pain was coming from. We just really wanted to make sure that it was nothing serious, nothing but a cyst, and didn't want to wait until Monday to see my doctor. So that's why we went in. But the whole time, hubby and I were saying, even before we got to the hospital, we were saying the boys are fine, the boys are fine, the boys are great. So we knew that everything was going to be fine. Confirmation is always good. You know, pictures are worth 1,000 words, and we got the pictures of our boys. So I couldn't be happier this morning. I do need to go and lay back down, because they still are going to be rupturing and letting out that fluid, and it's going to continue to annoy my abdomen. So I just need to take it easy and relax. But that's it for now. Bye.